Dr. Edward Diao is one of the nation's leading hand surgeons. Trained at both Columbia and Harvard universities, most recently he was Chief of Hand and Upper Extremity Service at the University of California's Medical Center in San Francisco.
Well, so imagine if you have arthritis and you have a painful joint, and mechanically there's extra movement, and mechanically that joint is not as secure. And then having to open a package like this would be very difficult. So I'm going to try to measure the force for a PopPack, and I'm going to try to put the fingers where they're supposed to. That opened pretty easily. The time that I needed to sustain that was, I think, much less than for some of these other packages. Interestingly enough, position of the joints and the wrists make a difference. When you open a jar, you sort of have to have the wrist at a certain angle. Whereas something like the PopPack, you can adjust that angle to actually increase or decrease the forces that you could generate. You can do it with your wrist bent or straight. And that can be a way for somebody who normally has less strength in the hands to be able to still maneuver the package. Not only are the small joints in the hand stressed, but the muscles in the forearm have to fire. So for example, we're showing imaging of the forearm and the elbow, and that's where the origin of these muscles in the forearm attach. And in these areas here, it's very common to get tendinitis, and sometimes people require surgical treatment to decompress those areas. Well, I think with my patients who have problems with conventional packages, if I could direct them to packages with a PopPack, they would say, thank you, because it would really help them out.